My name is Nika Reynolds, and welcome to my Teaching and Learning Strategies class. I thank you for joining me today, and also joining me is Miss M and Miss C. Thank you, ladies, for joining me. My teaching strategy will be focused on case studies, okay? And the topic is problem-solving skills with providers within an insurance company. Okay, these two ladies are analysts, and I'm just trying to teach them some information through case studies and maybe a little role play if we have time about resolving the issues with providers. Okay? Now, as an analyst, what you have to remember is there are many issues that comes up during the day with providers. Okay? In reference to billing practices, the amount of money they're billing, the higher billing codes that they send in, and many other issues that comes within your reach, okay? All right, what issues? The issues can be anything from double billing, duplicate claims, or anything like that, okay? You as the analyst have to keep in mind to look out for those things when you're monitoring a provider who has billing practices that are being monitored. The problems are very diverse, so you have to be aware and have to have the knowledge in how to approach these providers. So therefore, what I have done, I have created GRASP. GRASP, G-R-A-S-P, is the way you approach providers when they come to you when they call for a billing issue. G means you gather the information, okay? R is review any prior cases, because some providers tend to, once they're out of being monitored, they tend to go back and do the same thing again, okay? A, apply your knowledge, okay? S, share info with the provider. What we want to keep our providers, ladies, we do. So one thing that we do, we try to give them enough information so they bill the right way, the claims get paid the right way, and so forth. Okay? And problem solve. Have a conversation, talk to the provider, say this is what you're doing, this is this, you have to bill this way, you cannot bill 3 codes at the same time and duplicate. You have to do the appropriate thing so the insurance company doesn't pick up on it, because we do pick up on it, which they're not aware of. So we do want to keep them, and we do want them to be our providers. Okay, and then you evaluate. You know, you can call them a couple of weeks later and say, you know, how are you doing? Are your claims being paid? You see that you're doing better. You're sending in the documents. You're sending in what needs to be done. Okay, so what I have here is a case study based on a provider. Does anyone volunteer to read this, please?
I'll read it.
Sure.
Hey, Dr. Janine Baker, DPM, is a podiatrist that is currently contracted with your insurance company. Lately, you have noticed that her billing practices have changed. For example, the surgery she bills for continues to have a higher billing code. You give it a few months and monitor the claims. A month later, you realize that the billing practices have gotten higher. You begin to pull a report that shows the changes in billing for the past year. You notify her office that you will now have to do a prepayment audit. The doctor's office calls in and is irate. You explain the prepayment audit to them and explain the audit is to monitor medical necessity. A month later, you get a call from Dr. Baker who states, you have been denying my claims and I need to have a face-to-face with you. The request is granted and a conference call meeting takes place.
Okay, very good, very good. So one of the questions we want to ask ourselves is, what will be your approach to solve the billing practice issues? And basically what you have to do is address the issues of the provider, okay? Ask them why, if they ask you certain questions about what's going on, why my bill's not being paid, and so forth, you address them and say, you know, Dr. So-and-so, this is an issue with you, you've been billing this way for a long time, we need you to not duplicate codes, practice billing one code that has something to do with another code, or a duplicate billing or duplicate codes. And you show them exactly how to do that, okay? Because we do want to keep them, like I said before. Okay, we do want to keep our providers. Could you read question 2, Miss M?
How would
Go ahead.
How
Anyone?
would you explain to the provider that their billing practices can affect the company, but the claims or patients they see? Example, balance billing when they try not to adhere to contract rates by the company.
Okay, so what it's asking here is how does the practices of the provider affect the consumer? And one thing we have to know is that billing practices will affect the consumer, the provider as well as the consumer, because a lot of people are stressed out because they balance billed. And some providers, they feel they have a right to bill a certain way because they're contracted, but little do they know it affects not only the insurance company but the consumer with collections, balances on medical bills and so forth. So they need to adhere to the contract and bill the right way, okay? So let's quickly go through this quick role play. You would be Dr. Baker and you'll be the analyst. Let's start quickly, please.
Dr. Baker, good morning. As you requested, I am here to answer questions about your prepayment audit.
I have been contracted with your company for years, and I should be able to bill any which way I want. You are now denying my claims, and I'm a participating provider.
Dr. Baker, please be mindful that all contracted providers need to follow the same protocol. If you do not follow it, you will be monitored.
Well, how do we resolve this?
When you send in a claim, do not duplicate it or add additional claims to the procedure code. Please bill appropriately. For example, if your procedure code is 28298 for surgery, it includes the equipment and visit. Do not send a separate claim for each of the equipment and the visit.
Thanks so much for letting me know what I need to do.
Very good, ladies. Thank you so much. So therefore, there's an understanding established here between the doctor and the analyst who oversees this provider's claims. And in that way, we can resolve issues and not have a problem in the future. It helps the doctor, it helps the insurance company, and it helps someone like me who would probably be the patient with medical bills. So in all view, overall, it's something that you have to keep in mind that not only are you working for your company to ensure that we keep providers that are very good and so forth, but we also want to make sure that they practice, honestly and proficiently, and in a way helps themselves and help us, okay? Or help your company or so forth, okay? So I thank you very much. I hope you've learned. Have you learned something?
Yes, I have.
And
I've had.
Most definitely.
Thank you, and thank you so
I learned
much,
that
and
too.
thank you. All right.